Welcome to our presentation entitled Using a Virtual Organ Simulation Tool to Motivate Patients to Decrease Alcohol and Drug Use to Improve Treatment Outcomes. This clinical research takes place out of the College of Health Science and Technology, Behavioral Health Division. We have a multidisciplinary team of talented students ranging from expertise in medical illustration to game design, and also postdoctoral fellows and clinical psychology interns in the field of clinical psychology, and content experts who have expertise in anatomy, physiology, addiction psychiatry, clinical psychology, and behavioral health related problems. This team has developed 3D simulation tools to be used as medical motivators that assist clinicians who are out in the field doing evidence-based practices such as motivational enhancement therapy and cognitive behavioral therapy. Before clinicians do the 3D simulation tool activity with patients, we have a baseline reading of how motivated the patients are, a scale from 1 to 10 to reduce or stop their substance use. This is given as a baseline right before the simulation exercise. This can be given on iPad, desktop, laptops. It's interactive in nature. Then the clinician shows the patient a 3D simulation of the liver from a healthy liver to damaged and a disease state. This allows this to bring the organ state into something concrete that they can look at and can be a discussion point between the clinician and the patient. The fatty liver, letting them know that there's a chance that to some degree can be reversible, but when it gets to a disease state, cirrhotic state, that can be life-threatening and end-of-life stage. Then the clinician can show the lungs with chronic smoking or vaping. This can have an effect on our lungs and the disease state from damaged to diseased. And the disease state becomes chronic pulmonary disease, again, life-threatening. This becomes a way, using these tools, that the clinician and the patients can talk more openly about the effects on medical well-being and physical health. And then the clinician can show the healthy heart and talk with the patient about how chronic alcohol and drug use can affect the heart, lead to problems with hypertension or heart failure, and how stimulant abuse, cocaine use, can lead to the damaged and diseased heart, and what to expect when it gets towards damaged and disease states in terms of symptoms. And then lastly, the neuron, the healthy, beautiful neuron. And with alcohol and drug use, that this brain cell, also known as the neuron, can become damaged and then diseased and eventually die off. Damaged states where the dendrites retract towards the nucleus, and when they become diseased, they retract even further. The clinician can let the patient know what behavioral symptoms to experience, such as cognitive problems. Then once again, we ask the patient at the end of all these simulation tools to rate on a scale from 1 to 10 how motivated they are to change their substance use. The goal being these tools can be a medical motivator to motivate clients to take steps at reducing their substance use. The goal is to get healthy behavior change. And using tools like this in the field is a translational research that our team is doing, using advanced technologies and merging them with evidence-based science to have healthy behavior change. Should you have any questions, please contact Dr. Caroline Easton, Dr. Richard Doolittle, or Dr. Cassandra Burberry, the College of Health Science and Technology. Thank you.